Thanks very much for the opportunity, Minister. Budget Day 2017. Obviously, ahead of the budget, you've given us some pretty positive signals about your approach to mental health. So would you like to just perhaps outline what the major headline initiatives will be?
Sure. It's a very significant health budget, but it's a particularly significant mental health budget. So not only are we dealing with the issues of guaranteeing Medicare and the pharmaceutical benefit scheme, of supporting our hospitals with significant investments, investing in medical research. Of real importance to me is the investment in mental health and preventive health. There's all up just over $170 million for mental health. That includes the $58 million that's already been announced for specifically dealing with veterans, their families, and both mental health, but also the tragic issue of suicide with veterans. Thank you for your work in that space. Then there is funding of $11 million to help in prevention of suicide at what is sometimes called suicide hotspots. The combination of barriers, of signage, of direct connection to support services. There's $9 million for rural telehealth, in particular for psychological services, extremely important for people in rural communities.
That was again one of the pre-announcements, wasn't it?
Correct. So that's been announced, sure. But I just think it's very important, as a service. $15 million for mental health research, with $5 million in Queensland for Sunshine Coast University and the Thompson Institute to focus in particular on youth mental health issues. Then we have the Hunter Institute and Black Dog, as well as the Brain and Mind Institute, and they're focusing on anxiety and depression. And then Origin in Melbourne is also receiving $5 million to allow them to complete their work in recalibrating their services with a special focus again on youth. The most significant element, I think, is arguably the $80 million for psychosocial services within the community outside of the NDIS. That includes those who are not covered under the NDIS, and more broadly community-based psychosocial services. This is something, Frank, that you and Mental Health Australia have argued for. It's contingent on matched funding and agreements with each of the states, but the money will be there, and if one state doesn't participate, their funds will flow back to the general pool. So there's an incentive for every state to participate, and I am confident that every state will. What we want to do is make sure that as the Commonwealth $80 million comes in, that's matched by $80 million by the states rather than they reduce it by that amount.
Sure.
And but the way we've designed it, there's an incentive for every state to participate. This risk, which you've identified along with others, of community mental health being lost as the NDIS, which is a very desirable objective, comes on stream, is real, and we're addressing it in the first budget that I've had the fortune to be involved with in the health portfolio. So thank you for everything you've done, and I appreciate it enormously.
Thank you, Minister. Obviously at our Advocacy Day, that was one of the big messages that we took to you, that we thought this psychosocial support gap was urgent and evolving as we speak. You said that day that it was your problem and you were going to fix it, that you'd spoken to your colleague Minister Porter, so we're really encouraged by that, and thank you, and I think that'll be well received.
Well, out of the day we had with the Prime Minister himself is deeply engaged in this issue of psychosocial services, and he was a tremendous supporter and frankly an advocate during the budget process, which is, it's great to see. You've got a PM who gets it, is engaged, and says, well, I'm not just going to say it was somebody else's fault, I'm in the job, and he and I agreed we're going to fix it.
Terrific. So we have an opportunity to talk directly to Mental Health Australia members. If you had a sort of message for our membership now about what this sort of means and how we take it forward, what would that message be?
I think there are three things. The first is thank you. The services you provide are fundamental. We know that there are 4 million Australians a year who suffer some form of chronic or episodic mental health condition each year. You protect, you support, you assist, and so many of you have lived experience, as has every family. The second thing is this budget represents a practical demonstration of real commitment. The Treasurer is dealing specifically with mental health as one of the fundamental initiatives in his budget speech. The Prime Minister was deeply engaged, and for me this has become hopefully my signature area of reform. Thirdly, your task now is to work with Frank and with Jennifer and with all of the Mental Health Australia team in encouraging the states to match what we're doing. I don't think that will be difficult because it's such a good offer and it's such a worthy cause and a necessary action. But your task now is to say to each of your states, this is great, now we need you to match what the Commonwealth is doing, and that will take our 160, our 80 and turn it into $160 million.
Minister, look, I appreciate budget day is a very busy day, so thank you very much for taking the time to talk to our members directly. I think the opportunity to hear it directly from you is very important, and we look forward to working with you to make this work. I think, as I said, I think the psychosocial support gap was one of our highest priorities that we put to you very early on. So we're very encouraged that you're taking some action there, and we look forward to making it happen on the ground.
Brilliant.
Good luck for the rest of the day.